All right, that's all. Hi there, today I'm going to be answering some of the internet's most asked questions about knee injuries, and I'm glad you're here with me. Hi guys, it's Dr. Sean Liu again. Nice to see you guys. Today I'm going to be discussing some stuff about knee injuries and knee surgery. Let's take a look at some of the most asked questions about knee injuries these days. Okay, question number 1. What are the treatment options for knee arthritis? Okay, that's a pretty common question. So first of all, knee arthritis is a degenerative condition that affects your knee. Knee arthritis can be graded into mild, moderate, and severe. And depending on which stage you are at, the treatment differs. Most of the time, for mild and moderate arthritis, we go for non-operative treatments. And for moderate to severe arthritis, there are operative choices. The non-operative treatments involve things like changing a lifestyle, going for physiotherapy, and perhaps even injections into the knee. If your knee pain is caused by moderate to severe knee arthritis, you can have the minimally invasive surgery for moderate osteoarthritis, and you can have the total knee replacement for end stage or very severe arthritis. Okay, that's done. On to the next one. What happens if a knee injury goes untreated? So it all depends on whether or not it is a severe injury, it is a mild injury, or if it's a combination injury. The good news is our body has an inherent ability to heal. So if you do nothing about a knee injury, sometimes just ice it and see whether or not it goes away, there is a fair chance that your body actually can handle it and it can go away. Now, if you don't feel better after a couple of days, or there are a couple of signs which show that the knee injury is a little bit worse than what you thought it was, then you should go and see a doctor. These signs include when you have got acute pain and the pain doesn't go away even with rest, or if you have pain with every movement you make, or if you are unable to weight bear, you cannot put any weight onto the leg, or if you have got a big swelling of your knee. Now, these are all signs that it could be a severe injury, or it could require a professional to go and take a look at your knee injury. Okay, let's go on to the next question. Do your knee tissues really get removed during knee surgery? Well, that's an interesting one. So the basic principle of knee surgery is to try to repair and restore as much as we can. We do remove knee tissue. So for example, if you've got a tissue which is very badly damaged and there is no way to repair it, then we'll have to remove it. Sometimes, if your knee is very degenerated, then the areas which we cannot repair anymore, those parts are removed and we replace it with something else, like a total knee replacement. Right, on to the next one. How long does it take to recover from knee injury? So it all depends on what you injured in your knee. Usually for simple muscle strains, simple ligament sprains, you take maybe about 6 weeks to recover from it. For fractures, it takes 6 weeks just for the fracture to gum together, and then up to 3 months for it to become strong again. If you've got a bad cartilage injury, the cartilage doesn't tend to repair by itself, but the area becomes less inflamed, and so you might not feel as much pain. It doesn't mean that that area is recovered. For the last thing that often gets injured and does not recover are meniscal tears. And because of the blood supply toward that tissue, some areas that are torn are unable to scar down, and some areas do not actually repair by themselves. Okay. Is knee pain normal? How do I know if I have a knee injury? I'd say that knee pain isn't exactly normal. Usually, it comes with an incident event, like if you fell or you twisted your knee, but there are times where your knee just starts aching for no reason, and there are other reasons you might actually have this knee pain. Some of them involve inflammatory conditions such as gout, or it could be from somewhere else and some other part of your body, like if you have got back problems and your knee is painful because of a nerve irritation from your back. So those are some of the most common questions I get about knee pain and knee injuries. I've got more coming up. Stay tuned for part 2. Ciao!